today I'll be talking about diabetes. Before I start my presentation, I'll show these 5 photos. Can you find any similarities between them?
Animals?
And these are both living things, creatures, animals, but most importantly, these are the top 5 mammals that are likely to get diabetes. And today I'll be talking about types of diabetes, symptoms, treatments, preventing, and lastly, quiz. First is types of diabetes. There are 3 types of them: type 1, type 2, and gestational diabetes. First is type 1 diabetes. It is also known as insulin-dependent diabetes, and it's caused by beta cells being destroyed by autoimmune reaction. 자율 면역 반응. And these beta cells produce a thing called insulin, which acts as a storage for glucose. And since the storage is gone from our body, the amount of glucose that should be kept in insulin will be released, increasing the amount of glucose in our body.
Can you say that again in a slow pace? Because I don't think people understood.
Beta cells, type 1 diabetes is caused by beta cells being destroyed by autoimmune reaction. And these beta cells produce a thing called insulin, and it works as a storage for glucose, 포도당. And since the storage for glucose is gone from our body, the amount of glucose that should be kept in insulin will be released, increasing the amount of glucose in our body, therefore increasing our blood sugar level. And this is the main cause of type 1 diabetes. Next is type 2 diabetes. It is also known as insulin-independent diabetes, and it is caused by a lack of ability to produce or effectively use insulin. So I can compare type 1 diabetes and type 2 diabetes as type 1 for a dead person and type 2 for a person in a vegetative state. Last is gestational diabetes. It happens during women's pregnancy, and it goes away after you give your child birth, but it often increases your rate of getting type 2 diabetes. Next is symptoms. First is frequent urination. You go to bathroom a lot and go in order to pee. Next is increased thirst. You feel thirsty a lot and often. And third is weight loss and blurred vision, tiredness, slow healing, skin issues, and increased hunger. And as you can see on this photo, there are also sexual problems or numb or tingling hands or feet. And third is treatments. For type 1 diabetes, since our body cannot produce insulin enough, insulin injection is one way, and you should also keep your lifestyles healthy. And for type 2 diabetes, lifestyle changes is also important, such as changing your diet. And medications also helps too, such as insulin injection like type 1. And lastly, you should keep monitor your blood sugar levels like this guy is doing on his or her hands. And for gestational diabetes, you should first change your diet, such as eating more vegetables. And for medication, insulin injection is also another way. And some people might have a question that is insulin safe for babies, and it is safe. And lastly, exercising. Exercising such as cycling and swimming might benefit too. And now it's preventing. First, you should eat healthier. Rather than eating high calorie or fast food, what about eating vegetables? It'll benefit you more. Next is trying to lose your weight. If you feel that you are overweight, you should try to lose your weight, because actually losing weight is very hard. So just trying might help you too. And lastly, you should stay more active. Instead of just sitting in chair or doing work, going outside to exercise might help you. This is end of my presentation. And do you have any questions?
그 게스테이셔널 다이비티스가 그 임신 중독 임신 당뇨 얘기하는 거야?
임신성 당뇨네.
근데 그걸로 했는데 사이클링을 해야 된다고?
약간 임산부.
임신을 했는데?
임산부도 약간 for like permanent women, they do like swimming or like acrobatic, and cycling not like the.
It might be dangerous for
like outside cycling, but like indoor cycling.
Oh, okay. What's the difference between type 1 diabetes and type 2 diabetes?
Type 1 diabetes, in type 1 diabetes, your body cannot produce insulin.
Okay.
But for type 2, you have insulin, but you just can't use it.
Oh, okay.
Now the first question is naming.
Oh, I think he has a question.
So how does the third diabetes happen?
Like
임신성 당뇨라고 했잖아.
아니 그러니까 그게 왜 일어나는지.
임신과 관련된 거 아닌가?
if you are pregnant, like you always always feel like, so if you're pregnant, your body will become like, your body will not become unhealthy. So like insulin is located in pancreas, so these kind of things might be turned unhealthy.
뭐 일시적인 임신한 당뇨는 일시적인 거예요. 임신했을 때만 나타나는 당뇨예요. 그리고 like I don't know if I misheard, but like you said something about like you were comparing type 1 diabetes as a healthy person, and then the other one is a
Type 1
vegetative
for a dead person and
dead
type 2.
person.
Yeah.
Oh, okay.
The first question is naming 3 types of diabetes.
Type 1, type 2.
Type 3.
Yeah, you're all correct. And next is naming 1 symptoms of diabetes.
Like urination.
It's all correct. Thank you for listening.
Okay.